Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. I am pleased to welcome my friend and colleague from the Arizona College of Podiatric Medicine, Dr. Don Curtis. Dr. Curtis did his undergraduate work at the University of Utah. He did his podiatric medical studies at the Scholl College of Podiatric Medicine. He did his residency in Phoenix at the Carl T. Hayden VA. He spent time in private practice, and he's been with the Arizona College of Podiatric Medicine since 2012. Welcome to Dean's Chat, Don.
Thank you. I'm excited to be here.
Well, thank you. You know, we have the fireside chat vibe on the Dean's Chat, so we're going to go with first names. You're Don, I'm Jeff.
Perfect.
So Don, I want a lot of things I want to cover today, and it's always fun to talk to the professors at the college because all of us are involved in student education, from recruiting students all the way to graduation. And so I thought we'd just kind of walk through your history and your journey in podiatric medicine to start, if that's all right.
Perfect, yeah. So again, an undergrad at University of Utah, is looking into different medical fields and stumbled upon podiatry, actually just through working at the University of Utah medical facility, the hospital up there, and was leaning towards something surgical. So I was working actually as a unit coordinator on the post-op unit floor there, and I noticed that the podiatrists seemed to be the most relaxed. They enjoyed what they were doing. They loved their work. So I was able to then shadow some, and it definitely then piqued my interest more and more. I learned that it would definitely work well for me and what my goals were.
So how many different podiatrists did you see coming through the hospital when you were saying, hey, these guys, this might be for me?
It was there was just a few that were like on staff at the university there. And so as a result of just shadowing them a little bit, seeing some of their post-ops, the majority of the ones that were being admitted at the time were the diabetic patients that had either large infections or amputations, things of that nature. And so it just piqued my interest. It was great. I had a chance to shadow them. Then I had an opportunity to just across the street from the university hospitals where the VA in Salt Lake is. So I was able to then go over there and shadow a little bit as well.
Wow. And
got to see some of the nitty gritty of what we do. And as a result, it really was just like, once I learned about it, it just kept snowballing into the point where I was like, yeah, this is totally for me.
You know, some things never change. It seems to be a universal experience that the shadowing situation is one where students go visit podiatrists. Podiatrists are typically happy doing what they're doing because they've tailored their practice to what they like to do. And the shadowing experiences kind of solidifies the deal, if you will, and they want to be podiatrists.
I agree. That's how it worked out for me for sure.
So once you decided you wanted to go into podiatric medicine, how did you decide where you wanted to go? How'd you end up at Scholl?
So at the time, I was actually leaning more towards the San Francisco College. At the time, that was kind of where a lot of the individuals that I had shadowed, a lot of the people I had talked with were going. And I did interview there, and it was a tough decision. But I remember when I interviewed at San Francisco, it was a great experience. But then there was just something about Scholl that just spoke to me, I guess you could say, and we decided that's where we wanted to go. So it was not the original plan, but I'm glad it worked out really well.
You were in the same class as my old practice partner, Dr. Eric Chicola.
That's right, yes.
No, I know. That's how I got to know you initially, so that's great. So when you went through 4 years at Scholl, what was the clerkship experience like? Where did you go around to ultimately find yourself in Phoenix at the VA?
So Scholl was unique, and I remember at the time there was a lot of one-year residencies. There were a lot of different rotations that we had to do just because there was so much in the Chicago land area. So we did not have a ton of opportunities to go all over the country. Third year, I had a rotation with the MedStar, what's now the MedStar group in Washington, D.C. That was a great experience as a third year. And then I had a sister that lived in Phoenix, so I'm like, I'm going to go check that out. I also went to the University of Utah or the VA Phoenix or the VA in Salt Lake, and just a couple of those spots that I would have enjoyed living in. And I think the clincher was that at the time, Phoenix was the only 3-year program that I was looking at. And I really felt like that would be important to get as much training as I could. And so it ended up being my first choice, and it worked out.
Well, that's fabulous. It might be a good way to segue into having mentors, because you and I have a common pathway there. Who have been your mentors so far in residency and through practice?
So another big plus for the Phoenix VA was Jeff Page. He is actually what then drew me into the working here with students at Midwestern. He's been a great role model for me. He was the residency director. It was during my second year that he ended up transitioning from the VA in Phoenix over to the school,
right,
starting the program there. And so I would definitely put him as the prime mentor for me. Obviously, there was a number of great physicians I worked with back in the Chicago area, and quite honestly would have probably enjoyed working there in a residency. There were a few of those that I was definitely interested in as well, but there was something. He was great. He was great to work with as a student. He taught well, and as a result, it just was the perfect fit. I felt.
I think Dr. Page has mentored a lot of people,
yeah,
myself included. When I was at the California College of Podiatric Medicine, Dr. Page was the Dean of Clinical Education, and so I worked up patients with him, and it's no surprise that when Dr. Page retired, I talked to him about coming here. So it's a small world in podiatric medicine, that's for sure.
And I know he's connected with many over the years. He's been a good one to shadow and follow for sure.
Now, you didn't jump right into academics out of residency. You had spent some time in private practice, right?
Correct, yeah. So when I finished, I actually went up to Utah for a few years. Going home, it was a great experience. I started with as an associate within a practice, and then over that first year, it was pretty clear that there wasn't necessarily an ownership opportunity. And so I was able to maintain that associateship for a couple days a week. And then I started something else a couple other days a week. And then over the span of about two and a half years, it was growing like any, just getting started practice would. But during that same time, everything down here in Arizona started to just go crazy. It was when the big housing boom, people were moving in like crazy. And so one of my good friends from residency, one of my co-residents, had started something here in the East Valley, the Gilbert area of Arizona, and called me up and said, "Hey, would you be interested? We need to expand. Things are growing like crazy here." So I was able to kind of sell my little portion of that to one of the graduating residents from the U, and moved to University of Utah, and then moved down and worked with him for a handful of years until I ran into Jeff Page again, and he kind of recruited me over to the school.
Very good. So you've been a centerpiece of the educational experience for our students here in Arizona. You have a unique experience in that you are not only academic faculty, but you're clinical faculty in the clinics. How did the teaching experience affect you? I mean, have you always had education in your blood, or has it been something that's been acquired over time?
It was definitely more acquired. I was not necessarily anticipating that this would be where my career would end up. I love teaching. I think that's something we all do, even as regular clinicians. We're always teaching our patients. We're always interacting with and trying to help them to learn how the best way to help themselves to get better. And so that component of the profession has always been a plus for me. We in the practice that I had in the East Valley, we also had students rotating through. And so that was where I learned a little bit more about, how to interact with the students. I also did a half a day a week at the VA residency program during that time.
Good.
So there's always been an element of teaching, but the idea of full-time being here at the school was never really anything I anticipated. And then I actually crossed paths with Jeff Page again at one of the local CME events, and we got to talking, and there was an opportunity to come. And one of one of the main reasons why it was attractive to me was that there was that clinical element. I don't think I would have wanted to come and go full-time teaching and not have that clinical experience still. I think it helps me to continue, obviously, because I enjoy that patient interaction. I enjoy doing the procedures and all that we do in the profession. But it's also been really fun to learn the classroom and the academics and some of the other aspects of teaching and mentoring and helping these students to achieve their dreams. Well,
So what has been your favorite course to direct here at the college over the years?
I've been able to have some fun with some different courses for sure. So the Podiatric Medicine 2 course is kind of where we focus on the diabetic foot, the peripheral vascular disease, all of those issues with these patients that are obviously having so much trouble. So I like that because there is this element of, I really do feel like that is where we make the biggest difference. And it's really great for me to be able to work with these students and help them recognize that there is such a need, and it's a need where we're needed, but it's also a need where we can really make a difference in these patients' lives. And so I really do feel like that's the class I like to teach. And I also enjoy the surgery, the trauma, some of these others that I've been able to teach, because obviously students really love when they're playing around with all the hardware and all the fun surgical procedures. So I've been pretty fortunate to be able to teach some fun classes. But I would say, yeah, the diabetic foot in that area is where I feel like we make the biggest impression on patients.
When I look at the syllabus you put together for PodMed 2, it's world class. I mean,
it's pretty crazy, huh?
You bring in David Armstrong, and you bring in Warren Joseph, and you bring in Bob Freiberg. I mean, that is really a world-class course for the students.
It's a great course. And it's obviously not all me. It's fun when we get these experts in the field to come in and share their passion for this as well. And you can see that passion kind of translate into the students, and they get excited because it's right towards the end of their second year. So they're almost out on rotations, and that's, again, it's something they're going to see, and they're going to be able to make a difference right away. So it's a really fun course to be involved with.
I think so too. And I think it's also fun because during that course time, they're finishing their 2 years of basic science work, and they're all just chomping at the bit to get into clinic, and they want to get through boards part 1.
Yep.
And I think that it kind of provides them a light at the end of the tunnel.
Most definitely. Yeah, I agree. You can see their enthusiasm. You can see how drained they are as well. So it's kind of give them that spark, like, hey, there's a lot of fun stuff, and you're making a difference. So keep it up. Get through this next couple months with boards and finish out these basic science courses. Obviously, pharm's a huge one that they're but they're trying to tackle. And I think it is really a great time to introduce this subject of diabetic foot, the vascular procedures that need to be done to help these patients heal, all the different offloading and different grafts and techniques that we have available to us. It's really there's just so many options for them to learn from.
It's a great course to take, and it's evidence-based medicine too,
right,
from the course. So they're learning techniques that have been tried and proven, and that they can employ when they're out seeing patients as a clerk.
Yeah, and that's one of the things where I hear back from the students all the time, because I still go down to the Phoenix VA, on a weekly basis, and I get to see the students from other schools as well. But one of the real positive feedbacks is when I see the students again a few months later, and they've been like, oh yeah, I ran into this rep that you brought in for one of the different workshops that we did, and they've been hands-on. They've been using these grafts. They've been using these total contact casts. They've been doing these things that we taught them. And like, yeah, they felt more prepared.
Absolutely. It's interesting also, I get calls from residency directors and clerkship directors around the country, and they're all impressed not only with our students' knowledge and their professionalism, but they're impressed with their general medicine background. So
Yes.
I think our school has really done a nice job. Dr. Rajan has just been really prepared our students for being in the hospital environment and their training.
Yeah, and if they're comfortable, then they're going to be more confident to be able to step in and help out, be more involved.
Absolutely. Confidence and competence go hand in hand.
For sure.
No doubt. So, Don, over the last, 18 months or so, we've kind of been shifting your responsibilities. You're going from teaching the advanced surgical courses, and you've kind of come back into the earlier times, and you're actually the director of admissions right now for the college. How has that transition been for you?
It's been surprisingly fun. I've really enjoyed it. I've had the opportunity to go to a few of the undergraduate institutions around here up in Utah, and even our Midwestern colleagues in Downers Grove. I've been out there talking with some of their master's students, doing little workshops, introducing them to the field of podiatric medicine and surgery, and it's been great. Some really fun feedback. Again, going back to how I learned about it, it was just, I kind of stumbled upon it, and I think that there's so many individuals out there that if they knew more about this profession, they would probably love it.
Right.
And it's just our job, obviously, to get that word out there and help people to see what this profession has to offer.
Absolutely. Kind of a shameless plug for our admissions department at Midwestern University. We're a multi-professional university, right? We've got a dental school, a vet school, a medical school, a podiatry school, and every imaginable health profession. And I think it's been interesting over the last year how many of the students that have applied to the DO program have shifted gears and came over to podiatry.
Oh, that was really an eye-opener. Obviously, last year being kind of that first year that I really got into the whole admissions, but being able to talk with those students that were basically trying to figure out what they wanted to do, they didn't know that podiatry was a separate school or a separate degree or any of that, and being able to introduce them to the field, have them go shadow, like we mentioned, that's a big draw, because obviously when someone loves what they do, it kind of sells itself.
Absolutely.
And that variety of what we have to offer within the profession of surgical, sports medicine, dermatology, older, younger, you get the whole spectrum. And I think that's really appeals to a lot.
I think that appeals. And also, you've been interfacing with all the students right from the beginning. They like the fact that they know what they're going to be.
That's a
right
good
when
point.
They come in the school.
Yeah. They know their specialty is kind of already designed. It's part of the curriculum. It's part of what they're going to do. They're learning from day one.
Right. I've had a lot of students have commented on that. And in like the MD world, I think 47% of the students get their first pick for specialty. And I think it's like 74% get one of the top three. So there is something to be noted that if you go into podiatric medicine, you're going to be doing podiatric medicine and surgery.
Yeah. You've got that surgical opportunity from day one. You know that you're going to have that. You're going to learn it as a student. A lot of the surgical residents don't really even learn a whole lot about surgery in their didactic years.
Right.
They're learning all that after the fact. And so I think it's pretty neat that we can put together these courses where we talk about trauma, where we talk about flat foot reconstruction, where we talk about total ankle arthroplasty, all of these things, giving them examples and showing them how it's done, even as a second and third year student.
Right.
It's pretty neat.
Well, it's interesting because they go from the admissions process and then we accept them into the school, and they move to Phoenix in the middle of summer because our quarters start the second week in August. And then you've also taken on PodMed 1, which is the introduction to our profession for these students. So it's a natural segue from admissions to PodMed 1. How's that experience been for you?
I've enjoyed that as well. The PodMed 1, just kind of overview, it just really is an introductory course. It's helping them to understand a little bit more about how to do a history and physical, obviously more foot and ankle specific, picking out the more classic things. We introduce them to hammer toes or bunions or plantar fasciitis, things that they're likely to see when they're going out on some of the different volunteer opportunities that we have our students go through even in that first year. Second year, there's different clinical opportunities. And so we want them to be, again, a little bit comfortable. They may not be totally competent, but at least comfortable in that setting. And so this class really helps them to learn the steps involved in getting a patient history, getting a physical. Maybe they won't know how to treat all of these things. They don't, but they're at least getting themselves into that situation so that they'll go to these homeless shelters or go to the marathons or the runner's den or one of these different opportunities that they'll have and actually can contribute a little bit. Special Olympics especially is one of those that really is a great opportunity for our students to go out.
Absolutely. And that's a good point, because you sure don't want them going to these events and not knowing anything. That's kind of the foundation, ancient histories and physicals.
Right.
But we also start basic skills where our students are actually going into doctor's offices and in our clinic at the campus right away in the second year.
Correct.
And you're contributing to that effort too.
So that's part of the kind of, it's almost like you see the transition from again, admissions, get to know these students in that element. That once they matriculate, we get them started with the PodMed 1, where they can learn how to do some things. And then one of the courses, it's actually set up into 3 different semesters or quarters, is that basic skills class. And so they are able to basically rotate through clinics as well as the homeless shelters, Special Olympics, different activities that are set up where they have an opportunity to really get in there and do some hands-on care.
Absolutely.
It's pretty neat.
No, that is really neat. And so when a student is interested in podiatric medicine, I have a couple questions around this. One, what do you tell a student when they initially are interested in coming to the Arizona College? But maybe more important, what are the top questions you get asked out of the clear blue sky?
Oh, that's good. So probably some of the main questions really have to do with the career itself, like, how does it all work together, especially when we're introducing it to these students that have never shadowed, they don't know exactly what it is. So it is kind of highlighting how we are different. And I think some of the things that really seems to appeal to these students is that the fact that we have kind of that nice hybrid between medical and surgical. It's, as we all know, it's really rewarding when someone comes in and they're in pain and we can do something to help relieve their pain right there on the spot, whether it be an injection, ingrown toenail, bracing, orthotics, whatever it might be. We can actually make a difference right away. And so I try to emphasize that a little bit when we're talking, because obviously there are a lot of areas within medicine where, all right, let's go have you do these x-rays and we'll check back with you in a couple weeks. Take these pills, whatever it might be, right? So I love the fact that we as a profession can do a lot of procedures and do things right there on the spot, but then also supplement that with the proper antibiotic if it's an ingrown toenail, or the injection if we need to, and get them in the right orthotics or shoes. So highlighting those kind of how the daily routine within our clinic works seems to really highlight those things that differentiate us from other providers.
Kind of like a career awareness effort almost.
Almost, yeah. It's like introducing them, letting them see what we have to offer, and then they pick out from there. Okay, well, I really am interested in surgery. So then we can kind of focus a little more of our discussion on that. Oh, I don't really care much about surgery, but I really am interested in the sports medicine. Or I have a grandma that had diabetes and had problems. And so then we can obviously touch on that.
So it's so important. And I think, just for our listeners, our profession is undergoing a major effort called Feet on the Street. It's a student recruitment effort where all 11 schools and colleges of podiatric medicine are contributing. And here at the Arizona College, we're going to visit 20 schools. And you've basically signed up for all of Utah, and I've signed up for all of Colorado.
Right.
So we're going to go up there and we're going to introduce undergraduate students to a career in podiatric medicine. And then we are also going to team them up with a designated shadowing / mentoring doctor in the community. I think that's going to make a big difference.
I do too. Yeah, it's, again, there's so much that we can tell them, but until they actually see it and they recognize that not only is it a great profession, but but they can see how those patients really do appreciate the care they're getting. That's really when it kind of sinks in. And I think I can just refer back to my own experience. It was really neat to see that the doctors were happy and the patients were happy. You don't get that in all different medical careers,
No, you're right. I think one of the common themes when we interview students is they say, when I shadowed all the different medical specialties, the podiatrists were the happiest. And again, I think that's because they tailor their practice to what they like to do. But not everybody has that opportunity.
Not everyone can do that. Yeah.
Right. No, I think it's a great opportunity, and it's so fun to talk to students and see the light go on.
Yeah, exactly.
Fantastic. So we just had the white coat ceremony last weekend with our first year class. That was fun. It's kind of all their families come into town, and all of a sudden it's real.
It is. Yeah, I love that. I mean, even though obviously did my own back in the day, but it's fun to hear that oath year after year now that I've been here for 10 years or so. It just kind of puts again into perspective. We're here to obviously help people, and this is a great career to do so.
Oh, I agree. What's interesting is they're at white coat last weekend, and then we blink and they're at graduation in a few years. So it's
and
crazy.
What's even more weird is when, I've seen these students as first years, and then they go to residency at the VA here in Phoenix, and I'm seeing them 7 years later graduating. That's pretty wild, because obviously 7 years is a long time, but to see how they've progressed from day one to however many days, 7 years it's pretty cool.
Yeah, it's we're so proud of the students when they do that.
It's so great.
It's interesting. I've got an interview coming up with a couple of students that I had. One was a student at Barry when I was there, and one is a student from here. And they've both gone through residency, they've both gone through fellowship, and now they're in practice. So I'm looking forward to talking with them.
Just touch base with them again.
And see how they're doing.
It's pretty wild.
So Don, any last words? Anything else you want to add about the Arizona College of Podiatric Medicine or the profession?
No, obviously I've been very happy with it. It's been a great career for me. It's provided well for me and my family. It's given me the opportunity to get involved in areas I didn't ever anticipate, such as teaching and being involved in the school and admissions and research. And there's there's so many opportunities within this profession. So I'm a fan for sure.
Yeah, me too. No doubt. Well, speaking for everybody, it's great working with you. You're such a wonderful colleague, and I think we just have a great team at the Arizona College, and I think the benefactors are the students for sure, and ultimately the patients down the road.
I agree. We've got a good environment for learning, and I think we all work really well together. So, I think it's been great.
Well said. Well, to all of our listeners out there, I want to thank you for joining us on Dean's Chat. We're kind of highlighting the Arizona College of Podiatric Medicine today, but realize there are 11 schools and colleges of podiatric medicine, and it's just a phenomenal career. And if you're listening on Spotify or Apple Podcast, please give us a 5-star rating. If you're watching on YouTube, please become a subscriber. And Don, I've got one of these Dean's Chat cups for you.
Perfect.
Yep. And so cheers, everybody. Bye-bye.